In a matter of weeks, children between the ages of 5 and 11 could be eligible to get the COVID-19 vaccine. Pfizer is asking federal health regulators to greenlight its shots, and Central Texas public health officials are already making plans for it.
And KXAN's Jennifer Sanders spoke to a family who is currently in trials for this vaccine, as well as a doctor, about what comes next.
We really didn't know.
After going through a COVID-19 vaccine trial, Russell Schultz decided to enroll his 8-year-old son Owen in the Pfizer trial for kids 11 and younger at Austin Regional Clinic.
We kept asking, does your arm hurt? Do you feel tired? And we took his temperature for, I think it was a solid week afterwards was the protocol. And he didn't show any signs.
In the clinical trial, patients weren't told if they received the Pfizer vaccine or a placebo. Several weeks after Owen got his second dose, they had him tested for antibodies, and he had them.
We wanted to know because we were going to travel, and so we know that he got the real deal.
In the Pfizer trial, kids 5 to 11 received a 2-dose regimen 21 days apart. They got a third of the dosage used for ages 12 and up. And the company says the vaccine showed robust neutralizing antibody responses.
With the pediatric vaccines specifically, they're also looking at what is the correct dose. And so how did the company evaluate the dosing strategy?
Dr. Manish Nayak at ARC says now that Pfizer has requested approval, the FDA will take several weeks to review all the data. He says ARC is ready to issue vaccinations and will use the same process it used for the adult vaccines. We also checked in with Austin Public Health, who says it had already expanded vaccination capabilities because of COVID-19 booster shots. APH says it's ready to make sure enough resources are available when it's time to give children the vaccine. And we also heard from Austin ISD that pending approval, it'll offer the shots at existing scheduled vaccine clinics. Robert?
Thanks, Jennifer. Well, state health officials tell us they are no longer allocating COVID-19 vaccine doses to providers. Providers will order doses directly from the federal government. On October 26th, an outside panel for the FDA will review Pfizer's data.